Chartwell will be dispensing all hazardous medications, including chemotherapy, with a closed system transfer device on the end of the tubing. A closed system transfer device and the acronym is a CSTD. They prevent the escape of hazardous drug and vapor concentrations outside of the system. So as long as this is intact, this internal pathway, it is closed, no vapor will be able to escape. Because of that, the manufacturer provides these little red caps. They call them red hats. These hats are the end cap that fits snugly on the end of the Spiros. It is unlikely that it would become dislodged in transportation. Would it become dislodged for any reason, the manufacturer also recommends cleansing the blunt tip, that blunt cannula, with an alcohol wipe to disinfect it. We are not able to utilize the regular Luer end caps because that female Luer is what engages and opens up that closed system. So you'll see when I connect this, this whole blue unit will move down. So when that slides, it's closed, and then when it slides down, it's open. You can see it moving there. So because of that, because it's open, when I would remove this, and that which would close that system, we would have liquid and vapor at the end of that blunt tip and or inside the cap. You will want to make sure you have a neutral pressure needleless connector. It does not need to be this one. You can use any needleless connector with a Luer attachment, the female Luer attachment. However, it must be neutral pressure. This does have a negative pressure component, and with that, if you would have anything other than a neutral pressure cap, you run the risk of having leaking at that connection. So you'll go ahead and scrub the hub, remove the hat, push, and you can see when I push, it opens that pathway, and then I will turn it to connect it. At the end of the infusion, I will remove this. This is now closed, and then I will dispose of this attached to the tubing in the bag.